It's gonna be good, it's gonna be great, it's gonna be better, I can't wait. Making my move, live for the day, sing like a bird, fly like a plane. Come spill with me, Jenny D.
Hello, my beautiful people. Thank you for joining me with another episode of Spill With Me, Jenny D. Today's episode is brought to you by Clair Health. And joining me today is Dr. Bridger Clarke. I am just so excited that you took the time to speak with us, and you specialize, you're the chief of GI.
Gastroenterology, yep.
Yes, gastroenterology. I know. I wasn't sure if I could say
It's
that.
easier to just say that. That's okay.
And
It's a mouthful.
and digestive health too. So since March is Colorectal Cancer Awareness Month, we're talking about colorectal cancer prevention, the importance of screenings, and what people should know about colonoscopies. And we'll even take a look inside the colonoscopy suites and show the listeners exactly what to expect. So thank you so much for taking the time today.
You're welcome. Thank you for having me.
So Dr. Clarke, to start, what exactly is colorectal cancer and how common is it?
Colon cancer is a cancer of the large intestine. So the colon is the lower part of the gastrointestinal tract. It's about 5 feet long in most individuals, which most people are kind of surprised to hear, but it is involved in digestion, breakdown, and production of stool.
Oh, wow.
But, colon cancer is a growth that develops on the lining of the colon or rectum. And it is very common. Something like 1 out of 20 people in their lifetime may be affected by colon cancer.
Kidding.
Yeah. Third most common cancer in the United States in men and women. So it's very common.
Wow.
And the reason we're meeting today is because it's one of the very few preventable cancers.
Oh, nice. Okay,
Yeah.
so that the rate of that, like the percentage, is a lot higher if you catch it early.
You would say that if everyone got screened, there may not be any colon cancer. And if people got fewer colonoscopies, there would probably be a lot more.
Yes.
So,
well, you were saying 5 feet. You mean 5 feet like?
in length. Yeah. So the colon is a tube. It's I tell patients your GI tract's about 30 feet from your mouth to your rectum, not to be too graphic, but, as an explanation of what we deal with. And so the colon is the large intestine, it's very bottom of the GI tract. And it's about 5 feet in length. It goes up the right side across the top, up the left side across the top, down the right side. And anywhere in that space, you can develop precancerous polyps and colon cancer.
The things I'm learning. Thank you for explaining that to me. So why is colorectal cancer often referred to as one of the, we just talked about the most preventable cancers. Why is it?
Because with most cancers, I think, and most of us probably have experience with friends or family where all of a sudden they're found to have a cancer. Most cancers don't have warning signs. When they're early and when they're developing, you don't have symptoms. You may not have any understanding that they're developing, and that's true of most cancers. And so colon cancer, that's also true. It always starts as a precancerous polyp, which is a little fleshy growth along the lining of the colon, and they don't cause symptoms. You'd never really know if you have polyps, but 1 out of 3 people get polyps. And so we consider colon cancer one of the most preventable because if you find the polyp and remove the polyp, colon cancer doesn't develop.
Oh.
So that's the focus of colonoscopy, is find those things, get them out of there. So a lot of cancers, the focus is more on early detection. Mammogram for breast cancer, it's largely about detecting it before it might be symptomatic. This is about preventing it before it ever happens in the first place.
Right. Get it while it's like just in
before it
beginning
happens.
stages. Right.
Yeah.
Who should be getting screened, and what age should people be thinking about colonoscopies?
Well, the short answer is really everyone should be getting screened.
Right.
Colon cancer can affect anyone, no matter how healthy you are, no matter, lack of family history. it is always a possible, thing that can develop during your lifetime. So everyone should be screened. In the United States, the screening age is 45. People might be familiar with age 50 used to be for a number of years, and it dropped down to 45 several years ago because we are just seeing colon cancer rates in younger individuals go
Oh
up.
my
Colon
gosh.
cancer is number one cancer killer under the age of 50 now.
Oh my
Um,
gosh, I didn't know
so
that.
so the age has dropped down to 45, and I think the focus is identifying those individuals who would be at risk early. So, i.e., individuals with polyps. So, if you're starting to develop polyps at an earlier age, you should be watched potentially more frequently. And if you don't have polyps, then you get 10 years between procedures. So I tell most people, look, it's a few times in your lifetime to protect against one of what is more common cancers out there. But yeah, 45 is where we start for most individuals. There are some factors that may impact that. So if you have a strong family history, we generally recommend age 40 or 10 years earlier than when your loved one was diagnosed. That's a minority of patients. For the
Right.
most part, this is talking to average risk individuals who may not have any inkling that this is something that could afflict them during their lifetime. And so screen early and understand your risk, and then that protects you.
Oh, so true.
Yeah.
Now, would you say more women get colorectal cancer or men?
The rates are fairly equivalent. I want to say men probably slightly higher, but for both categories, it's the number three cancer, excluding skin cancer.
Right.
So it is common in both categories. I think we'd say, generally speaking, we see a little higher rates of women screening, especially at earlier ages, which is why we may see a slightly higher uptick of colon cancer in men down the road. But it doesn't discriminate based on sex. It can affect
Right.
anyone.
And we were
Yeah.
talking about this off air, Dr. Clarke. You were saying and it's so true. Women, we're already conditioned to get screenings because of breast cancer.
Yeah, yeah.
Things
This
like
is
that.
something it's a thought that I had as I was kind of thinking about this. That I do think that women are exposed to more concepts of screening kind of earlier in life with mammogram and pap smear and prevention of certain cancers. And so, going through those things, you get familiar with the healthcare system, and you understand that while it's not your favorite, moment,
Right.
it protects you. And at the end of the day, it's very routine. And so I think men are perhaps, less used to and comfortable with exposure to these things. They go, I feel fine. Why do I need to get
I
this done?
know.
So it's just maybe a little more of a foreign concept. And so that's why sometimes it's a little tougher, getting some of the men on board
It's
with this.
very true.
Yeah.
You were so correct when you were saying that because I never even thought about that. Never came to my mind, but it's so true that women are already conditioned to get this test and get this test, and we're like, okay, we'll just get this test too.
Yeah, I think sometimes men, it takes a little more arm twisting to get them on
Yes.
board. Yeah.
Now, are there risk factors people should be aware of?
Yeah, I mean, I think we'd say the main risk factor is age.
Yeah.
It would be almost unheard of in the 20s or 30s, although, there are exceptions to that rule. And we're seeing the age get younger.
Mhm.
But certainly older individuals at more risk than younger individuals. Family history will impact that risk. And then there are some kind of lifestyle things, although, again, I think it's a minority of situations, but obesity, smoking, heavy alcohol use, diets rich in red meat, processed foods.
Oh, really?
Yeah, there is some contributing factor to that, but in the scheme of colon cancer, in some ways I don't focus too much on that because I say, you could be the healthiest, skinniest vegan in the world with no family history and get colon cancer.
Right.
So,
Right.
it doesn't choose, pick and choose who it strikes. So,
Right.
but there are those risk factors, which quite honestly, not doing those things are good for your entire body and for most health issues, but colon cancer included.
Yes, absolutely. Why is early detection so critical when it comes to colorectal cancer?
Yeah, I think, as with any cancer, early stages are always more treatable. Early stage colon cancer has a 5-year survival over 90%. So, catching it early, it's very treatable. And again, the flip side of that, the further along, the more advanced it is, the tougher it is to treat and the tougher
Right.
it is to cure. But in colon cancer, so, there is an element of early detection I think we can kind of think of where, certainly there are patients that come in for their first screening test that we will find colon cancer. And that's a small fraction of people. where we would detect it early. But more commonly, what we're doing is preventing, not
Yeah.
detecting early, but preventing. I mean, that's really what the focus is.
So last year I had an interview with actually she works at the hospital and she was a patient and her symptoms were her stomach was bothering her and they at first she's like, oh, it's nothing, it's just my stomach.
Yeah.
And then when she went in for her colonoscopy they did find that she had colon cancer like
I,
that. Like there's no signs, right? Like there's
I mean, certainly when you have polyps, I mean, generally speaking, we would say no, there's no signs. Early colon cancer, basically no. I mean, seeing blood in the stool would be something that you would say,
yes.
well, you might think of, but many times when we find it, patients go, I didn't see any blood, and we go, yeah, I think probably the most common way that we find colon cancer is people just get routine blood work and they're anemic. They're found, so you go to your
Oh,
PCP one year and they get the CBC like they always do. Last year it was normal, and this year it dropped a bit. And they may check your iron panel, tends to be a little low, which can be an indication of microscopic blood loss. That is
wow.
absolutely one of the most common ways that we find this. I found a colon cancer yesterday. We were just investigating low blood counts, but not seeing any bleeding at all. So that's one of the more common ways. And again, like it could have been kind of slowly oozing
Hmm.
blood, little tiny microscopic drop for 6 months, and then lo and behold, you're anemic, you're tired. That's how we find it a lot of the time.
Yes.
Yeah.
Oh, that's so scary. Now, how, like many people delay their screenings. What's the biggest misconceptions or the fears?
Yeah, I think of course there is. I think there's a lot of sort of fear, embarrassment of just what it all may entail, what the bowel prep might be like. That you have to drink all this gross
Well,
stuff, and
everybody's got something different. My husband took pills. I took
yeah,
the juice or the
yeah.
I call it juice.
And I tell people, look, like it's really not critical how you get there. If it gets clear,
Yeah.
you're good to go. And there's lots of different ways to do that. I think that's one of the fears and the barriers to people getting it. And then I think just the concept of having a medical procedure, especially, in your 40s when maybe you haven't been exposed much to the healthcare community, again, with men versus women,
Right.
where you go, I go in and have, get sedation and go through this thing that, you hear horror stories of perforations and things that, are largely a thing of the past at this
Right.
point. Nowadays, it's become one of the most routine things that we do just, every day of the week. And so I think it's education, getting people over some of those misconceptions and maybe some of the historically kind of hearing these things, which nowadays it's just it's one of the most routine things we do.
Right. And
Yeah.
I remember, I don't even know how many years ago mine was. I better get it checked. But I got both done. I got the endo and because I was
Yeah.
actually having a lot of gastro, like my stomach was bothering me and my family has like some stuff that's going on with the esophagus. So I was like, I might as well, my doctor's like, you might as well get both done while you're there.
Yeah, and it's you mentioned your friend or somebody you knew who was having some stomach issues, and they
Mhm.
came and they found it. That does happen, and most of the time it's unrelated. I mean,
Yeah.
because we see a lot of stomach issues develop for 100 different reasons. That's
Right.
why our field exists, and the vast majority of the time it's not related to any big deal like that. But we would say, well, geez, thank goodness you had the reflux or the food allergy that brought you in, and we just
Yes.
happened to find a big polyp or an early colon cancer that was not causing your symptoms. But without investigating these things, we never would have found it. That absolutely happens.
Yes,
Yeah.
that's oh my gosh, thank you
Yeah.
for clearing that up too. Now, how often do people typically need a colonoscopy? Like if the results are normal,
Yeah.
like
So
the
10 years is
okay.
the recommendation. We start at age 40 every 10 years. So again, when I'm kind of talking to people, I go, it's a few times in your lifetime. It
Right.
protects you against what is one of the more common cancers.
Yes.
Now, those patients with polyps, which again is about 1 out of 3 people, we tend to watch those patients more regularly, and that comes down to how big, how many, family history. So
Right.
there are other impacts. So if you're in that group of patients who has precancerous polyps, you may always be prone to growing more of them. And that's okay. Again, it affects a lot of people.
Right.
1 out of 3 people in this building will have polyps. It's just the nature
Yes.
of the beast. It's not something you can control. And so those patients, I mean, it tends to be every 5 years, something like that, knowing that if you grow polyps, we find them, we remove them, that protects you. There are
Right.
rare individuals it's less than 5 years if they have a number of them or if they're large, but for average risk patients with no polyps every 10 years, that should provide protection against ever dealing with this. tough
Yes,
disease.
right. Thank
Yeah.
you. Now, can screenings prevent cancer, not just detect it?
Yeah. So
Really?
that is really the name of the game with colon cancer screening. It is about prevention. And again, there's a handful of other cancers where there are tests that can be sort of preventative. I think the analogy I sort of use with patients, it's like skin cancer. Your dermatologist might see a little precancerous thing and they'll freeze it off.
Yeah.
You can prevent skin cancer, but most cancers, you know, you can try to detect it early, or unfortunately, a lot of them, it's just, you have no control over it. There aren't
That's it,
screening
right.
tests for other GI cancers, pancreatic cancer, and things, which, there's a lot of research going into how to better early detect or screen. But colon cancer is one of the more common ones that has been shown over many years of screening to be totally preventable. It
Yes.
always starts as a precancerous polyp.
Oh my
So,
goodness. Oh my gosh. Thank you so much. So we are going to be back. Dr. Clarke, tell us where we're going to be doing now.
yeah, well, so we're going to take a tour of the GI endoscopy suite. So this is where the magic happens. So we're sitting in a GI suite right now where we do colonoscopies. So we're going to kind of take a tour of what the process is of coming in to get your colonoscopy, and how you come through it, and how you recover and then get out of here. And so we're going to just take a look at the St. Clair, the Dunlap Center here, which is a beautiful new facility that is state of the art, and it's a great place to have a colonoscopy.
Yes, thank you so much. So we're going to be
Okay.
back. We're going to go get the tour. See you in a little bit. Hi, we're back. So we are here today standing at the colonoscopy suites, okay, at St. Clair Health. And Dr. Clarke, can you walk us through what happens when a patient arrives and for their procedure?
Sure. Well, you park and get to walk into this beautiful building, and this is back in the kind of pre-procedure area. So usually come back with your family, and we can.
I was going to say somebody has to drive you.
Yeah. So you get a little bit of twilight sedation for the procedure, so you sleep right through it, and afterwards, you need a driver to take you.
You definitely
home.
need someone to bring you.
Yep.
Okay.
So this is one of our typical kind of pre-procedure areas. So this is where you come in, you park your car, take the elevator up, and then come right into the room. They have nice private rooms here, and basically nurse will kind of check in. Usually spend half an hour in here at most. It's a pretty quick turnaround. Kind of just get ready for the procedure. They just check some vitals, make sure you're feeling okay. So this is where you come back to afterwards also. So you have a little space to kind of wake up and not have your loved ones take, YouTube videos of you while you're saying silly things. So this is where your pre and post procedure kind of brought back to a private space where you can kind of recover and then leave from here.
I love that, because where I went, they had curtains up, so it was kind of like I felt like I could hear the person next to me.
Yeah.
Now, when you were saying to prepare for it, what's the preparation? Do you have to give blood work or IVs, or I don't even.
So you do need an IV. So in terms of when you come in, you basically change out of street clothes into kind of a gown. Usually give you some colorful socks, and so change into the appropriate attire for the procedure.
Yes.
You get some vitals done, and then you do need an IV. The nurses here, obviously, as you can imagine, they do it all day, every day.
Right.
But you get an IV, which just stays in during the procedure, so they can give the medication, which is very quick-acting medication. So put you to sleep within moments and awake very quickly afterwards, which has been one of the newer parts of modern colonoscopy. Is the sedation super quick and easy. It's the safest, much better than 10, 15 years ago when it would tend to last a lot longer. How long does
when you get into the twilight and the procedure?
I mean, well, so the procedure itself, most colonoscopies we would say are around 20 minutes, maybe something like that. Without polyps and without anything to kind of take longer, it can even be 15 minutes. It'd be very rare to be over 25 minutes, quite honestly. The process of going to sleep takes seconds, really. When I had my colonoscopy, I tried to count to 10, and I think I got to 4.
Same with
and
me.
it's you don't have much success trying to kind of live it out.
Right. And it was a nice sleep. I actually felt refreshed. I was like, wow, what, it's over already? It was so quick. I was just like, I can't believe it's over already.
Yep. Yeah. The experience of the actual procedure, universally patients will say oh, it was great. I got a great sleep, and sometimes they have an interesting dream, and sometimes they don't. And yeah, the medication is very effective. It's very safe nowadays. So,
Now, how soon can patients return to their normal activities?
I mean, we generally say 24 hours or the next day. Some of those recommendations, were created when we used older style of anesthesia that would just really last much longer. So a lot of times patients, when they leave here, they go like, I feel completely normal. I could drive home, but
Yes.
the rest of the day, I want you to rest. And especially for colonoscopy, you've been doing the prep and, not eating for the day before very much mostly. And so you want to take it a little easy, but really the next day, most people can return to work and return to regular activities. But we say, no driving the rest of the day, just as a precaution, and just kind of take it a little easy.
Right. And I remember, when I thought, okay, I'm going to eat a cheeseburger when I leave but I wasn't even starving. I actually felt good. Like I felt like I was like, oh, I feel like I lost like 10 pounds.
Yeah, it's funny. It really runs the gamut. Some people go like, oh, I've been planning this all month. I'm going to go out to a buffet. I'm going to get this. And then other people go, actually, I could do this more often. I feel good. So yeah, it's just really, I think after mine, I went and had something good, didn't overdo it, but
Right.
Yeah, most people are hungry and go right back to eating.
Yeah, and you think to yourself, oh gosh, I don't know. When you don't know what's going to happen, I think that's what a lot of people, the misconceptions of like, oh, I don't know. It's so easy.
Yeah,
It's so
and then
easy.
once you've done it once, I think it takes all the fear factor away from it. And
Yes.
as I turned 45 this year, I had my own colonoscopy, and even as someone who does this all day every day, I had a little bit of nerves going into it. Just you're going through a medical procedure, but
Right.
again, knowing I found many 40 and 50-year-olds who have had big polyps or cancer, and
Right.
just knowing the importance of it, very clearly, the importance of it outweighs any of those concerns. And
Absolutely.
it's become such a routine thing nowadays, and every year it gets better, safer, more effective, and it's been done since 70s, 80s. So at this
Wow.
point, it's a perfected art, and it's very, very safe. And in the scheme of life, there's only so many health issues you have control over, and this is one of them.
It's
And it's
true.
not something to mess around with, really.
Yeah, because was saying this other question, many people feel nervous or embarrassed about getting a colonoscopy. What would you say to someone who was putting it off?
Yeah, I mean, that it is just very safe, very routine, and just extremely important.
Like, why would you be embarrassed though? Because it's like you do this all the time. It's not like, you
Well,
know,
I think, the whole concept of you're going through a procedure, sticking this
yeah,
camera places, I don't know what it's going to be like.
right,
But I think the reassurance that the procedure itself, I mean, the vast majority of the time, it's quick, simple, painless. You wake up like nothing ever
right,
happened. Universally, people will say the prep is the worst part.
right,
Beforehand, you have to drink this liquid or take some pills. There's different options where,
right.
you have a bunch of bowel movements, you clean things out. Even the preps have gotten much, much better over time. So, it's not your favorite 24 hours because you're drinking liquids, eating broth, and then
Right.
you're going to go drink some of this stuff. But the actual procedure is very quick. And so
Right.
the whole experience of 24 hours of kind of doing this, one day out of 10 years of your life to protect against third most common cancer, it's
Right.
something that you go, geez,
Absolutely.
it's something we find all the time here at St. Clair. And you go, it's education is important because it's so preventable.
Yeah, right. It's,
Yeah.
you get to that point in your life that you're just like, you know what? I want to get all my tests done. I want to make sure I'm on the right road. And it's
Yeah.
every 10 years.
Right.
So it's not like I remember I had a friend that she did the prep while she went and she ended up, they couldn't do it because she did not flush everything out.
Yeah. And that can happen. The concept is it's got to be cleaned out so we can find polyps. Polyps start off as a single abnormal cell and then get bigger, and over more than 10 years, they can transform into colon cancer. So you want to find those polyps. If they're big,
Right.
even if it's not perfect, you can always find them. But we want to find every polyp. So we
Yes.
want to have a good prep. So we find every little teeny tiny polyp and get it out of there. So there are some situations, it is a small fraction of people
Right.
where, especially someone who's never done it before, maybe, they weren't able to finish it, or,
Mhm.
sometimes just the first prep they try doesn't work. I mean, again, 95% of the time we don't deal with these issues,
Yes.
but sure, we grade the prep. We want that excellent look, so we feel very confident that you're safe for 10 years.
Right.
And if it's not perfect, we may have to say, well, we want you to come back in 5 years. We know you have nothing big, but I just can't rule out small stuff. Again, that's uncommon, but that underscores the importance of getting that good prep done. And even though it's kind of, not your favorite day to do that, that's why we do it, is to make sure we find anything that needs to be found, and then make sure you're safe.
Right. And like 2 days before you're going to take the prep, you eat light. You don't eat like a big meal, go to the buffet.
Some people do. Some people go, oh man, the day before I went on Clear liquids, I just loaded up. And the preps are designed to do the job. So,
Exactly.
even with that, the majority of the time it's okay. But yeah, you're supposed to be on Clear liquids the day before. So, I loaded up with Jello and broth and Gatorade and, lose a few pounds of lightweight, and then you gain it back when you.
I know. I felt so good.
Go to First Watch.
I feel so nice.
Yep.
Like maybe I should drink this liquid every so often. I'm like, no, maybe not. Now, this is procedure painful? I mean, how would you know?
No, it's not. I mean, it's not a painful procedure. And again, like over the years, any of the parts of it that potentially could produce pain have largely been done away with. So like people used to have bloating and discomfort from all the air inflation. Right. Well, now it's largely all been switched to CO2. So CO2 insufflation during colonoscopy gets absorbed and you breathe it out. And so you wake up. So all of the bloating and the distension that we used to see 15 years ago is just a non-issue anymore. It's just really something we don't see. The devices are all much more flexible. We largely use pediatric scopes for our colonoscopies. Most individuals do. So they're little tiny flexible tubes. So any of those factors that could have in the past contributed to discomfort during the procedure are just largely a non-issue anymore. So it's very, very uncommon. I mean, almost unheard of to have any discomfort after the procedure.
That's what I thought. So what do patients typically say after they've had their first colonoscopy?
Well, typically they say, that wasn't so bad. Jeez, I thought it was going to be awful.
I know.
Yeah, and the prep wasn't fun, but the procedures. And then, the patients that we find polyps, they go, wow, I never would have thought. I mean, I've had lots of real young, healthy people, and they go, I can't believe it. The best is when, a husband and wife will come in together and, it's, the husband's, maybe have some health issues that he's trying to work on. The wife's super duper healthy and, she's got 6 polyps and he's got none. And you go, what? And you go, yeah, you can't predict these things. There's just no predicting.
It's not, that's the other thing is like lifestyle changes that can reduce someone's risk.
Yeah. It's something to touch on. I do think that, it's important in all aspects of health, smoking, heavy alcohol usage, obesity, diet high in processed foods and red meats. These things can impact not only colon health, but cardiovascular health. I mean, so these things, they're generally important things for health. They can reduce your risk of colon cancer. They can reduce your risk of many, many health issues. So they are really important. But, again, I think our focus so much is on screening and prevention, because even with those changes, you can still get colon cancer. So unfortunately, it is just something you do not have control over. You take control of those elements that you can, and it's important to do those things, but screening is the name of the game.
Exactly. Yep. What symptoms should people never ignore? I think we were talking about this before. Would you say like bleeding, stool?
Yeah, sure. Yeah, blood in the stool, some significant change in the bowel habits, unexplained weight loss. I mean, with this conversation about colon cancer and prevention, as we've discussed, unfortunately, the problem is it's precancerous polyps are almost always not symptomatic. So by the time there are symptoms, generally you're dealing with colon cancer. Right. But certainly any signs of a colon cancer are something you would never want to ignore. Seeing blood in the stool, abdominal pain that's new or different or progressing would never be something you'd want. Change in the stool caliber, we taught this thing, pencil thin stool, there could be a mass or something. I mean, any change that's out of the ordinary, anything like that, absolutely, especially if you're over 45, and especially if you haven't been screened, would absolutely be cause to speak to your physicians.
Yes. Yep. Yes. Yeah, I totally agree. Now, I had the endo done too at the same time because I was having a lot of stomach issues, and that was great because then I got to know what was going on.
Yeah, we do. We do endoscopies. I know we're talking about colon cancer screening, but endoscopy is another procedure that looks at the upper GI tract, and there are some precancerous processes in the upper GI tract that we will look for as well. And so, any upper GI symptoms. We're looking for different things in colon cancer, but also, of course, something you never want to ignore. Important to get that evaluated. And that procedure is even easier because you don't have to drink the bowel preparation, but it's the same, you
Yes.
get the same light sedation. And so there are other things we look for with the
I know.
upper
I was
scope
like,
too.
I'm already here, so I might as well get, both done. And so I was
Yeah,
like, okay,
sure.
good. Now I know, what to expect. And of course they said, no drinking coffee, no spicy foods, no chocolate. I was like, whoa, 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 whoa.
Yeah,
Because we have a lot of esophagus and things
acid
in
reflux
our,
and
yes,
stuff.
acid
Yeah,
reflux.
common problems.
Yes.
Oh yeah, very much.
So what message did you want to give most listeners want to take away during the colorectal cancer month?
Yeah, I think just that colon cancer is a preventable cancer. And despite being preventable, it's one of the more common cancers, which is just almost hard to believe. But it is because most people, have some apprehension about the screening process. So again, I think hopefully the take home is it's very routine nowadays. It's very safe. If you don't have polyps, it's once every 10 years, and it protects against what is, unfortunately, a common cancer that is affecting younger and younger individuals. And take control of your health and get screened and make sure that never happens.
Yes. Oh my gosh. Thank you so much. I'm so glad. So can we go in and look at the room real quick just
sure.
to see what it looks like
So,
in here?
Yep, this is where you get ready and where you get out once you're done.
Oh, there's the socks.
Yeah, there's the socks. There's a gown on the socks. So they have it all prepared for sort of.
What is the thing with the socks?
You get them every hospital you go to.
Yeah.
I think,
you get cold, maybe
most people may not. Yeah, I think
circulation.
it's not going to affect the procedure or where you might get EKGs
Yes.
and things. So it's a safe article of clothing. It keeps your feet warm, and then it's a little take-home present.
Yeah, right.
We don't recycle them.
You get a souvenir, and you have your own bathroom. And this is
yeah. So St. Clair, the Dunlap, the endoscopy suite here is amazing. It's a brand new facility. A lot. Some of the procedure rooms in other areas are a little dated, and there's privacy concerns and understandings now that you really want to have your own space, not only to get ready and get changed, but also to discuss anything with patients. We like to have private space, so they've done a great job here of making it just a great place and a very private place to do that.
Well, now because mine was years ago. Now I'm coming here because this to me is like when you say it's a suite. This is definitely a suite, and then you get to do your prep and you get to come back here for after the procedure.
Unfortunately, you don't stay here too long. It's usually a pretty quick thing. You're in and out, but while you're here, it's very nice.
Yes. Oh, thank you so much. So if you need a colonoscopy, if you think that, hey, I'm like 45 or I'm in my early 40s, go get it. It doesn't hurt to
been more than
even
10
be,
years, or if you're older, some people get the first one, they go, I'm okay, and they show up in their 70s and things like that. So 10 years, and talk to your physicians, and it's always a good idea.
Right, and this is the place to be.
Absolutely.
Thank you so much.
Okay, you're welcome. Thanks for having me.
So thank you so much for giving us that tour.
You're welcome.
I really appreciate it. It gives people more at ease to think, this is just a procedure and you're used to doing all these.
Yeah.
So if you're 45 and older, or you have a family history of colorectal cancer, it may be time to schedule your screening. Early detection can save lives. To learn more about colorectal cancer screening or to schedule a colonoscopy at St. Clair Health, call 412-942-6700 or visit stclair.org. Thank you again for being here today, Dr. Clarke, and thank you to St. Clair Health for being my sponsor. Take care.
Come spill with me. Come spill with me. Come spill with me.